Hi guys, today I'm going to demonstrate about the osteokinematic movements of all your joints, starting from the neck all the way towards the ankle. First I'm going to demonstrate the movements of your neck. So these are some of the movements. You can take a look here. Now if you bend your neck this way, this is neck flexion. Taking it back is neck extension. Taking it a little more back, it's neck hyperextension. Okay. Now you can also do neck lateral flexion to the right and neck lateral flexion towards left. There's one more movement in the neck. You can also do a neck rotation to the right and you can do neck rotation to the left. Okay, so that is some of the movements of your cervical column. I'm going to call it. Okay, now we're going to go to your shoulder girdle, where you're going to deal with the scapulothoracic joint. Okay, now this joint is where the scapula moves on the thorax. Okay, now some of the movements which are possible, I'm going to show it to you. You can do shoulder protraction, shoulder retraction. That will be all the way at the back. Okay, one more time I'm going to show it to you. This is shoulder protraction. This is shoulder retraction. You can also do shoulder elevation and shoulder depression. Now all these movements happen in your shoulder girdle. Now you already know that the bones belong to the shoulder girdle are your clavicle and your scapula. Okay, now I'm going to talk about some of the movements of your shoulder joint. Now shoulder joint is your glenohumeral joint, the ball and socket. You can do a variety of movements with this joint. Okay, starting with shoulder flexion, which I'm going to show it to you from sideways. If you take the shoulder forwards, this is shoulder flexion. And when you bring it back, this is shoulder extension. One more time, I'm going to show it to you. This is shoulder flexion. This is shoulder extension. You can also do shoulder hyperextension if you take it beyond the neutral. Okay? Now, you can also do shoulder abduction and shoulder adduction. Now, this rotation is also possible with shoulder joint. I'm going to show it to you with my elbow slightly bent. Take a look here. This is internal rotation at my shoulder joint. Keep in mind, the humerus is rotating on the glenoid fossa. This is external rotation of your glenohumeral joint. Okay, so that will complete some of the movements. But just before I leave, there's one more movement of a shoulder joint, which we call it horizontal adduction, horizontal abduction. Okay, so those are all the movements at your shoulder joint. From your shoulder, you're going to come down to your elbow. Elbow is a hinge joint, so you only have two movements possible there. One is flexion when you bend your elbow, and the other one is extension when you straighten it or you bring it back to neutral. From another view, this is elbow flexion, this is elbow extension. Okay, now elbow is a hinge joint, as I said. Now we're going down to the forearm. Keep in mind, at the forearm you have the radius and the ulnar. Now keep in mind, the radius and the ulnar, they form the radio-ulnar joint. It's a pivot. It belongs to the synovial joint. The movement's possible at your forearm. Take a look here. When your palms are facing up, we call this supination. Just imagine holding a bowl of soup. If you don't like the soup, you pour it down. Now this is pronation. One more time. When your palms are facing down, this is pronation. When it's facing up, this is supination. One more time. Hold the bowl, it's supination. You pour the soup, it's pronation. Of course, muscles are going to help you to do that. So from the forearm, I'm going to go down to the wrist joint. Okay. Now, wrist is a condyloid joint, which means it allows angle movements but no rotations. If you guys take a good look here, I'm just trying to show as much as possible in this position. Now this is wrist flexion, this is wrist extension, and this is wrist hyperextension. From another view, I'm going to show it to you. Take a good look here. This is wrist flexion, this is wrist extension, this is wrist hyperextension. Okay? Now, there are two more movements possible with the wrist joint. I can deviate the wrist like this and like that. Keep in mind, when you deviate your wrist towards your little finger like that, this is ulnar deviation, because you notice the movement is coming towards the ulnar, right? When you deviate it towards a radius, this is your radial deviation. One more time. The adduction at the wrist joint is also called ulnar deviation. The abduction is also called radial deviation. Okay? Now we finish the wrist joint, we're going to come to the fingers. It's simple. All the joints of the fingers, when you bend them, you call it flexion. When you open them, you call it extension. At the thumb, you have a special movement called opposition. Take a look here, the thumb can come and touch the other fingers like that. Now this is called the opposition movement, okay? So that concludes all the movement of your upper extremity, okay? Now, coming here towards a lower extremity, now you notice, I'm going to step back a little bit. Now, here you have the hip joint, which is a coxofemoral joint. You have your knee joint, which is your tibiofemoral joint. And of course, at the ankle, you have your talocrural joint, okay? I'm going to start with some of the movements of your hip joint. If you bring your hip forwards like that, this is called flexion at the hip joint. And when you bring it back, it's called extension. And you can also take it a little more at the back of the hip. This is called hyperextension. Bring it back to the center. Now remember, just like the shoulder joint, the hip can also do abduction, because this is also a ball and socket joint, just like the shoulder joint, okay? And bring me back, this is called adduction. Now take a look here in your hip, you can also rotate. When you rotate inside, it's called medial rotation. And this is called a lateral rotation. One more time. Okay, look here. Inside is medial, outside is lateral rotation. So those are all the movements of your hip joint. Coming to the knee joint, just like the elbow, the knee joint is a hinge. So the only movements which are going to be possible at the knee joint, if you guys look here, this is flexion of the knee and this is extension of the knee. Okay, some people do have a little bit of hyperextension, but here we're talking about the important movements, flexion and extension. It's a hinge joint, okay? We concluded the knee joint. Now I'm going to talk about the ankle joint. Hopefully my feet can be seen. Just going to adjust it a little bit. Okay? Now take a very good look. Now the ankle is known as the talocrural joint. Now if you do a movement of the feet towards you like that, this is dorsiflexion. Away from you, this is plantar flexion. That's what you can do at your talocrural joint, okay? Now, there's another joint underneath the talus, it's called the subtalar joint, where you can do a movement where you can turn your feet inside. This is called inversion. When you flip it outside, this is eversion. This happens at your subtalar joint. One more time, you open it in, it's inversion. When your sole is facing out, this is eversion. So that concludes all the osteokinematic movements of your lower extremity. Coming to your trunk, you have, this would be flexion, and this would be extension. A little more at the back, this would be hyperextension. You can also do trunk lateral flexion, and again the other side, trunk lateral flexion. You can also do rotation of your trunk to the right and rotation to the left.